On.
Hello, I'm Randy Barber, and welcome to Let's Talk Education. As always, this is a chance for you to hear directly from the Boulder Valley School District's team on important matters in the school district. A week ago, we had a special meeting in which we talked about an important update on the reintroduction plan. This afternoon, like many times before, we've got a great group of people that are going to help to answer your questions. Before I introduce them, I do want to just mention, as always, we do welcome questions from our community. If you have any, you can send them to bit.ly. That's bit.ly/LetsTalkBVSD. We'll also be looking on our social media sites for additional questions that come in throughout the show. And I will mention that we've gotten a lot of great questions over the last few days as we've been prepping for this. I know that this time around, we actually had quite a little bit of a warning because we let everybody know about it at the board as we put out the message after the board meeting. So without further ado, I'm going to go ahead and introduce each member of our panel today. Sam Messier is a area superintendent of the northwest part of the school district. Hi, Sam.
Hello, Randy. Happy to be here today.
Thank you. Just so you know, people don't get to see you unless you say hi, so that's why I'm going to make everybody do that. So sorry about that. Robin Fernandez, area superintendent, East Network.
Good afternoon. Nice to be here.
Thank you. Margaret Crespo, area superintendent, Southwest Network.
Hey, Randy. Hi, everyone. Thanks so much for being here and joining us.
Awesome. Thank you. Rob Price, our assistant superintendent of operational services.
Good afternoon.
Hey, Rob. Stephanie Farron, our director of health services.
Hi. Hi, Randy. Hi, everyone.
Thank you so much for being here. And then finally, we have a couple of special guests right now with us from Boulder County Public Health. Heather Crate, are you out there?
Yep. Thanks for having me today.
And I know Soda is supposed to be joining us as well. I don't know that I've seen her join yet, but she might join us later on in our show as well. Sandra Sonoda, what's her role, Heather, if you might just share that with us?
So she is our lead epidemiologist supporting K-12.
Awesome. Thank you for filling that in. One other note, we will be joined about halfway through the show with two special guests from our instructional practices side of things, Tiffany Lychok and Heather Hansen. And so we'll be hopefully kind of hearing from them in regards to what classrooms will look like as we make this transition. But before we really dig deep into all of your questions, we were going to have Heather go ahead and give us a quick update in regards to what we're seeing right now on the public health side of the deal.
All right. Thank you so much. Let me get this going. Sorry about that. Okay, every digital platform just feels so different. Is my screen sharing?
This morning we were on Zoom, which as she's pulling it up, I will mention that there is another good opportunity that is on Thursdays. Every week, the City of Boulder actually offers an opportunity to hear from Public Health, City of Boulder, and CU in regards to the update and BVSD joins that call. And so that's a good opportunity there. And then, additionally, always our website is a good place to look. Oh, there we go.
Whew, okay, got that up there. So I just wanted to give you all a quick update on how things are looking both in Boulder County as far as our current case data, as well as what we're seeing across the state. This is an important slide for us to look at as it compares the sort of Denver metro counties and how we're looking in comparison. So Boulder County here is this red line. And as you all can see earlier in September and even into almost October, we were having a pretty large case count, primarily due to our 18 to 22-year-old age range cases. But now you can see that Boulder County has dropped back down to kind of our standard place where we've stayed in that second lowest area as far as cases across the state. One of the main things that we wanted to share today is that we are still currently in Safer at Home Level 2. That is based on a set of metrics that's evaluated by us and by the state. And so the metrics that they look at are our 2-week cumulative incidence rate, which is currently 113.7, puts us well into the range for Safer at Home Level 2. We also look at our 2-week average positivity rate. And so Boulder County is currently, as of this morning, at 2.8%. And really where we're trying to stay is below that 5% to stay in the green. One of the areas that is starting to become a slight concern for Boulder County is our number of days with decreasing or stable hospital admissions. So in order to be in the green, you need to see 8 to 14 days of decreasing or stable hospitalizations. We are currently at 8, which is right on that cusp of 0 to 7, and that number has continued to drop down. So that is something that we are watching very closely and do have some concern around. This graph here talks through what types of cases we were seeing, in particular looking at the breakout of CU-affiliated residents. So the lighter bar up top, the lighter blue, shows you the cases that are associated with CU, and the darker blue down below is just general Boulder County population. So as you can see, in mid-September, we were seeing a very large spike. CU has worked in close partnership with Boulder County Public Health, with the City of Boulder, to really continue to drive these numbers down. And as you can tell, as of our latest case numbers, we're down below 20, which is great to see. This graph here is breaking out cases, a 2-week incident by age range. And so this darker line that had the huge spike is 18 to 22-year-olds. And you can see all of the other sort of age ranges, 0 to 9, 10 to 17, all the way up to our 75 plus, have stayed fairly consistent down below, with small increases over time in the 23 to 24 age range. But generally, those are all staying pretty low right now. So one of the areas where we're starting to have concern is that on the state level, our cases of COVID-19 are at an all-time high. So you can see here throughout October, those cases have been climbing. That is higher than what we've seen really since the beginning of this, and is definitely alarming and something that everyone is watching across the state. I know that Governor Polis has addressed this concern as well. As far as hospitalization, that we are also starting to see a climb in the state. And we know that the reason that we're starting to see this climb and increase in hospitalizations is due to an overall decrease in social distancing that we're seeing across the state. So something that is starting to happen is that now that we're 7+ months into all of this, folks are starting to get tired of being so vigilant, of social distancing, of masking, of being really careful. And so that's driven down some of those social distancing percentages, which is leading to increased hospitalizations. So I also wanted to share this. This is the last slide, but this is our age incidence at the state level. And so while we're seeing really good decreases in Boulder County, across the state, we're seeing an overall increase at every age category. And so we are, again, watching that. We're concerned about that, especially as we start to roll into the holiday seasons or the fall seasons, where folks are going to be indoors more often. So really the big message for everyone looking at this data is to stay vigilant, to continue social distancing, to, oh my gosh, I'm sorry. I keep getting notifications. I don't know if y'all can see those. To stay vigilant, to continue masking, to continue practicing social distancing, to avoid those even small social gatherings around Halloween and other Thanksgiving, fall holidays. And that is what I wanted to share with you all.
Awesome. I really appreciate that rundown, Heather. I think what we're oftentimes saying in the school district is it's almost like a week or a few days in this pandemic feels like forever in terms of years normally, and things are moving very, very quickly. A lot of the questions that we have today really have to do with why does one thing change from 1 week to another. And I think again, we and our partners in public health are, this is a partnership. We're really watching these numbers together. We don't have a crystal ball to know exactly where they're going to go. And so, having this partnership, I just want to thank all of you for your partnership, Heather and, Jeff and everybody at your team. It's just amazing to work with you guys. So obviously, with those numbers, we saw that those cases have come down a little bit from CU. So we're in sort of a more stable place now. At last week's board meeting, we did talk about that we are still moving forward as a school district towards reintroducing our students. And I'm gonna turn it over to Margaret Crespo real quick to kind of talk about what we discussed last Thursday night, just in a very brief way. I'm going to bring up our slides here as well, just so that she can kind of talk about what sort of changed that during that presentation, if that's okay, Margaret.
Terrific. Thanks so much, Andy. Randy, so really quick, you made me go fast and now I'm messing up everybody's name. So I will share that thanks to Sam Messier and Terry Mulford in the 2+ task force. They did some incredible work, and the original recommendation, as you can see on the slide, had us coming back in a staggering model with our grades staggered for a number of reasons. And once we determined through feasibility internally what would be the most appropriate opportunities for students to come in, considering all of our 4 metrics that we've used around safety, feasibility, finance, and supporting our staff, we were able to come up with the next slide, which I will wait for you to click that. There we go, which is the revised timeline based on our feasibility study that includes our kinder through 2 are already back. Our preschool started last week, and then we'll be launching 3rd through 5th grade October 20th. With a phase-in for 6th and 9th on the 20th, and then October 27th, our 7th and 8th, as well as 9th through 12th grade students will be coming back as well. And then our goal being that we would bring our students in elementary K-5 4 days a week, and our middle school students will be coming in 2 days a week in the AB cohort, while our high school students to start will be coming in on a 1-day-a-week rotation and the opportunity for teachers to work with small groups. Those students that would not be in school would still be receiving their home learning opportunities in school with an asynchronous day on Monday. That will continue for the foreseeable future as well. And just really excited to have our students back. As you can imagine, our teachers working really hard with our leaders to make sure that it's safe and appropriate for our students when we come back. And I just want to send a huge shout out. Our parents have been incredibly supportive, and going to buildings, we see our littles keeping their masks on and working really hard to be able to stay in school, and just want to say a quick thank you for that as well.
Thank you, Margaret. I really appreciate that brief update on where we stand with things. So as you can imagine, before we dive into the questions, I do want to mention that we did receive a lot of jubilant comments from parents and from students. Allison Santamayor wrote, "Thanks so much for the step towards progress. My kids are so happy tonight." We got reports of, young elementary kids, 3rd through 5th grade that were dancing, middle school kids that were doing high five to their parents, that kind of thing. So I do want to mention that before we move on. I also want to mention that I am coming to you right now live from Tars High School. This is one of their classrooms. It's set up for the kinds of things that we're going to be talking about today. Right here, we've got the Revis system that we can video back to folks that are remote learning, as Margaret was talking about. We're going to talk a little bit about what that all is going to look like. This is socially distanced. The tables are moved out a little bit in preparation for a quarter of the class to come back at a time here at high school. Okay, so with that announcement, one of the big things that we got questions about had to do with the assignments for secondary. So I'm going to hop right into that. Scott Sunnendale, I have a 6th grader at Casey, wondered, when will we know the 2 days our child will be going to school? Jeanette Sutton from Angevine asked the same thing. Will they be in cohorts? What kind of class size do we think that's going to look like? And at the high school level, Jack Reuter from Monarch High School, who has a senior there, asked, do we know what day of the week at that high school level it's going to be rotating through? I know that they're starting, next with 9th and 6th and 9th graders next Tuesday. The rest of them are going to be coming the week after. Margaret, I know that you guys are working hard at getting those assignments. Any sort of update that you want to provide there?
Sure can. So super excited for launching this. We're very grateful for our parents and their patience. and the students, because we know they're super excited to come back. I will share that our IT department has been working diligently because, of course, we also have to align our transportation, and Rob can speak to that as well. We will be sending a letter out shortly. By tomorrow is our absolute goal by the end of business, and I'll share really quickly what is happening. So for K-5, your groups will stay the same, as well as 6 through 8 will stay the same as they have been, AA and BB for their cohorts, because you're attending 2 days a week on and 2 days a week off. For students that are in high school, you'll receive your information by Friday evening as well, because we split that cohort. So if you are attending school on the 25% cycle and a 9th grader, let's say on the 20th, you'll be either on Tuesday or Wednesday. And that's the clarification that will be coming. And what your schedule will say, and we have a picture of it that will be shared in the letter that goes home, it'll say your attendance days. So it may seem a little confusing, like, why am I getting attendance days when I've always been in this cohort group? But in order for us to build our capacity for our attendance, honestly, to report to the state who's there and who's not, we have to kind of change our system of reporting. And I just want to say a huge shout out to Transportation and IT for working together to get this launched really quickly. And that information will be out by tomorrow afternoon. So hold on tight and be ready. Check in your IC to make sure that you're in there. If for whatever reason there's a change or something happened that you didn't request and it has changed, please let us know. A lot of this is based on how our cohorts are built for safety, as well as students on the bus. Who can we get on? What does that look like? And then lastly, to make sure that our classroom cohorting and spacing works. So let your principal know if there's anything that comes up. Otherwise, you should be good to go tomorrow afternoon.
So I think you just answered this, but I'm going to go and ask Megan Norris's question. She's got a student at fifth grader at Foothill and another at KC 7th grader. She wanted to know, if they need to change the cohort group because they want to remain engaged in the learning pod that they've got going on. And like you said, that really needs to be a conversation with their principal, right?
Absolutely, reach out to your principal, and they'll have a very honest conversation about the why and why not. If they're able to do it, we know they're accommodating as much as possible, and if they're not, they'll explain what the issue is or why the concern is. I'm just super grateful for our principals working with our parents. They've been incredible through this process. We get lots of kudos about the amazing work that our principals are doing. So just want to say thank you to them as well.
Similarly, and I think this kind of dates back to way back in July when we first started in regards to changing modes of learning. We got a number of questions in regards to that. Now that they're getting further down the line, they know more about what's going to happen. Obviously, as Heather was giving us that update, they know a little bit about what's going on in our community. And so a few questions about that. Vigo, a Boulder High School parent, asked if I decide that my student needs to go back online learning, can I do that anytime? Elizabeth Cruz, Monarch parent, asked if my child decides to opt out, will she be allowed to return back to her school at a later date? Jason DeWitt from another Monarch High School parent asked, how do I opt my student out of in-person learning? It doesn't seem like the link on Infinite Campus works right now, and you are correct. We have graded that out because, Robin, do you want to kind of talk about, essentially the idea here is that we really need those conversations to be in principals. In order to really move forward with this, we couldn't have things moving, super much, as students are in and out of classrooms. We needed to be able to plan with the students we had. But space available, they could possibly make changes in the future. Can you talk to me a little bit about what's going on there?
Sure, that's actually a great summary there, Randy.
You're right. A question there.
Yeah, exactly. So thanks for doing our work for us, Randy. So we have built our plans on getting students whose families wanted them to be in person, back in person as quickly and as effectively as possible. So to that first question, if a family wants their student to switch online, yes. But what we do know is that for students wanting to switch back to in-person, that is on a space-by-space availability. So if a school has a spot and you want your child to be in person, that is fine. Go ahead and contact the principal, and they are monitoring their numbers all the time. And we want any student who wants to be in person to be able to do that. And as we have space, we will get them back into their schools in person.
I know, Sam, you were out at some of the elementaries just recently for you actually have a podcast now that you're doing, which is fabulous. I know that you were able to kind of talk to them about how that's working. We understand that when a student is sick, that they need to stay home. And so I know a lot of schools, it might be different. I want to put this little preface out there. It might be different school to school, class to class, but you were able to see how this was working in a couple of the schools, right?
Yeah, it was really impressive. So just a huge shout out to the second grade teams at Superior Elementary and El Dorado K-8. Just amazing, amazing, amazing work that they've done to set up their classrooms and their learning environments so that they can really seamlessly handle both their students who are online and their students who are in person at the same time throughout the entire day. So they've set up these great camera systems. They've got multiple computers going and multiple cameras going, and the kids that are online can see the kids in the class. The kids in the class can see the kids who are online projected up on the screen, and they can all see the same thing that the teacher's presenting. And what's been happening, because I talked to them, they were talking to me about the fact that, yeah, they've definitely had kids who've been sick and who have needed to isolate at home until their symptoms resolve. And so the number of kids that's online versus in person changes almost daily for them. So, there might be 5 kids that have signed up for home learning the whole time, but if one of the other 20 kids is sick, then that number shifts. And then for that day, there's 6 kids online and 19 kids in person. And that just is something that's been sort of moving back and forth. Those numbers have just been shifting, and they adjust pretty seamlessly because they're set up to do that. And it's been a really easy transition for the kids who've had to stay home sick.
Now, I do want to mention a little bit of the yield. So, of course, that is awesome. That's what our ideal is to have that kind of flexibility. Margaret, I know that you and I have kind of talked about a little bit that in certain situations, we do need to make sure that, and I think about like secondary is going to be one world where you've got kids that are in the classroom and they're planning for those kids to be there and have activities for them and that kind of thing. A little bit of knowledge about that it's not, in some places it may not be super flexible. Kind of give me a little bit of insight into that.
Yeah, so that's a great point, Randy. We want to try to provide as much flexibility as we can within a system that has really tight parameters. So when we think about a student who becomes ill or something happens and that is longer, that they're not coming in and out of school on a regular basis, they become ill, like they get the chicken pox or something like that in the middle of this pandemic. Certainly, we want to provide them with as much access as possible to their instruction and education. And in a very honest and transparent way, where it becomes an issue for us is if students are leaving and coming back, it really impacts not only our cohorting system of keeping kids safe, as well as all of our factors related to keeping teachers in classrooms and making sure we keep those numbers. It impacts our transportation numbers. So it's very much a domino effect when there is that constant back and forth, which is why we've been very clear from the beginning, asking families to do things around natural breaks, connecting with their school, and if their student is out sick for a reason that isn't, very frankly, we're leaving the country for something that's not an emergency, we would ask that they contact their principal. We'll try to work with them as much as possible, but we really want to keep it very safe for our kids. So anytime that we check out, that check back in becomes a concern for us, both health and academically. So it's kind of a long answer, and I'm sorry about that, and can provide more detail if needed, but that's really where we're coming from.
It sounds to me, and correct me if I'm wrong, that the hope is, the heart of this is that we want to have flexibility and we want to meet most importantly, we're trying to meet students' needs. That being said, when we're setting up an in-classroom area, that means all these things, and so it has an impact. We need to know. We had a question from Megan Norris, I think, who I also asked a question earlier. The question about, if we just don't feel comfortable, obviously that comfort level is going to change from day to day, but we really want people to try to give it a try if they've opted in. But if you're sick or I don't know if there's anything else to say in that regard.
Yes, absolutely. And when they have questions, they can reach out to their principals and just have that conversation with them, and they can walk them through what works best and how to move forward.
Perfect. We have gotten a few questions along this line of, I'm going to, Miss Swanson, I'll just skip the first name so I don't mess it up, from Platt Middle School asked, if we decide to opt out our child from in-person learning, do we still have the opportunity to go Boulder Universal? I know that, and I'll just go and fill in this answer because I've asked about it just recently. We are accepting administrative transfers right now. Any sort of changes would be at semester if with space available is sort of the big question there. And so it's not just an immediate thing. It's not like at the beginning of the school year where it was sort of an open window at that point. Another big area, and now we're kind of returning back to our health area, is that big change. Weeks ago when CU was having the big surge in health cases, we really were talking about those elementary schools and trying to socially distance in those classrooms. So I know we've gotten a lot of families now that have asked questions in regards to that change to now have all of our students back. One question that we got from a parent was, what safety precautions are we taking? We're now doubling the size of student population by welcoming back grades 3 through 5. Why is it that middle school is going back in small cohorts? There's sort of a fairness sort of question from a number of parents, including Katie DeHaan, Louisville Elementary fourth grade parent, who asked, certainly 30 kids in a classroom goes against every scientific safety factor. It's simply impossible to socially distance with that many kids in that small space. Stephanie Farron, I know, we've had these conversations. First of all, we want to be completely, open and transparent that yes, there was a decision made in order to bring back our through fifth graders in which there is less social distancing. We will still socially distance whenever possible. But our intent was to try to make sure that we can reach that balance with students being back in for the full health of the student. What would you like to add to that? I'm filling in the blanks far more than I probably should be. Sorry.
I think it all goes back, Randy, to the layered approach that we talk about over and over that, that we're really implementing as far as screening before students get there, maintaining as much distance as we can, hand washing, wearing face covers, and yeah, your layers of protection. This is the neatest slide ever. And really all of those different layers give us more and more protection as each one is layered on top of it. And like, as you've mentioned, sometimes there's going to be one layer that might be missing for a while or might be not as strong as others. And what we're trying to do is ensure that this essential service of having students in school where they can get academic and social emotional support and all the other services that school districts provide are available to them as we layer on every protection that we possibly can. And so I'm not sure if that answers your question fully, but it's not a perfect system. And every system has, areas where you have to do a little bit of giving and taking. So sometimes we give a little on distancing, but we really reinforce hand washing and mask wearing and other protective measures like that.
Absolutely. I think that's the hardest thing, especially after we came out there and we talked about social distancing and that we were going to do that. I think people had a hard time sort of adjusting, but that's our philosophy on it, is those layers. And one of the other layers that we talked about at the board meeting was really the idea of the cohorting of students and how that relates to quarantining. As we reintroduced students, we knew that we were going to start seeing cases, and that's exactly what's happened. But the system is working well. And so I do want to pose a question to you, Stephanie, about quarantine. Kristen Drennan, Broomfield High School parent, asked, how will quarantines be handled? If a student in a cohort tests positive, what does it mean for my students?
Mm-hmm. Well, the first thing that happens is that there's a lot of work that goes on behind the scenes. We have a team of nurses that works with the school and the school nurse and the school staff to identify exactly what's going on, whether it's symptoms or whether we actually have somebody who's tested positive. Then we look at have they been to school? What classes have they been in? Have they ridden a bus? Have they participated in athletics or other activities? We look at all of those things, and then we bring all that data back to our public health partners, and we kind of sift through it together, and we determine what our next steps are. And then, if we determine that we have to ask some folks to stay out and to quarantine, we do contact them initially and let them know. And then after we've done that to any students or staff that we're asking to stay out, then we do a general notice to all of our school community. And I'll kind of throw this back maybe to you to talk about our dashboard.
Absolutely. And I know I was actually looking for the question that we had in here about the dashboard. I figured that you might be going there. I'm just going to bring up our website real quick here, flying by the seat of my pants here. But we did just stand up a new dashboard in our reintroduction page. And so if you go right to our homepage, this is the bvsd.org website, and click on the dashboard button, you will come to this new page. We are listing positive and probable cases here. Areas where we're looking at symptomatic, folks or somebody that's waiting for test results. We're not sure that it's actually a case yet. We've got resources. We've always promised that we were going to connect us back to all of our public health friends and their dashboards, and so that's where that is now. And then as we're issuing letters, again, as Stephanie was mentioning, we have a system in which we're contacting those that are directly related to the case. Those are the close contacts to these folks that have reported either a probable or a confirmed case of COVID. And then in addition to that, we're messaging to the entire school community so that they know, but we're also posting them here so that people can see those. You can actually search by the school or by the time frame that you might be looking for. And so this is a beta site, something that we're going to be building upon. But it's definitely a step in the right direction, I think, in terms of being transparent. And we've heard certainly from parents out there that are concerned about, they might have heard something about something, or, we had a situation at our terminal up in Netherlands. And so there was concern about, in fact, this might be a great question back to you, Stephanie, or even maybe our public health friends. But, when we have a quarantine, that's a proactive effort to try to protect people. And so we know that we've got a positive or probable case. Those folks that are directly contacted are the people that are in that close proximity. But, and if there was a bus driver that was at that terminal, that might be the case. But a student that's, riding the bus may not be in that window. Kind of talk about how that works a little bit. It gets a little bit, there's rules that apply to us on this, right?
There sure are. And what you're talking about is a contact of a contact. It's probably the number one question that we get because it just doesn't make sense. And like you mentioned, if somebody is asked to quarantine, it's because we believe, or public health believes, that they've been in contact, in close contact, or within a class or cohort with somebody that is either probable or positive. Those people are asked to stay home for 14 days. If during those 14 days they never develop symptoms, they never test positive, there is no risk to their family members from them individually. And that's why one person might be asked to quarantine, but their sibling might be able to go to school, or their spouse or their partner might be able to go to work. So that question does come up a lot. If the person who's a contact actually begins to get ill, like I mentioned, or does test positive, then their contacts are asked to quarantine. So it kind of builds on itself like that.
We did get a question that's related to this. So every day, as you mentioned, people are filling in that passive health screener. Christy D from Foothill asked, on the daily health screener, it doesn't ask about other family members, current health, parents, siblings, etc. For example, if it seems like in that environment, if a sibling was home with a fever, then you should be asking the student to stay home as well. Similarly, we got a question from someone that was asking about the new guidelines. I know this is sort of a two-part question, probably another one that we could pull on our friends from public health, but things are changing in terms of the requirements from the CDPHE, Colorado Department of Public Health and Environment, for those that don't like the acronyms. But in regards to COVID-like symptoms, especially cold-like symptoms that are minor on the, in the grand scheme of what they've kind of looked at before. The question was, regarding how do they, if we're waiting to see, I guess there's like a 48-hour period where we're looking at that minor symptom, how do we track that? There were some questions in regards to, whether or not if the student stays home sick, if that's part of what we're then tracking and how they do that if they're not filling in their screener. Woo, tons of questions. Why don't I start, Stephanie, with you on the question about the siblings, parents part, and then maybe we can open up to public health and some of that other one.
Sure. Yep, it's complicated, that's for sure. I guess I'll actually start with the symptoms because I think that does help us a little bit in the rest of your questions. Like you mentioned, CDPHE has new outbreak and case definitions for school environments. And there really are three different kind of levels of symptoms right now. There's a critical symptom that's a loss of taste or smell, and that Regardless of a test result in a school setting, you are asked to stay home for 10 days, which is the isolation period, and your contacts are asked to quarantine. Minor symptoms, which are headache and stomach ache and nausea, on and on, including sore throat and congestion, which this is the season for sore throats and congestion, unfortunately. You actually have a 48-hour window of time for those symptoms to resolve. If they resolve within that time, then you're free, to come back to school or to work. If they extend past that time, then we kind of move to the next phase. Major symptoms are coughing, shortness of breath, fever. Those symptoms, we have a 24-hour window for those symptoms to resolve before we kind of move to the next step. So in the case where you have one child in your family that's home with a fever, we would give them, the sibling would still have a 24-hour window that one day to attend school. If the fever went on past that 24 hours and we were asking that child to stay home, then their contacts would also be asked to quarantine. There's a 4-day window period from CDPHE, which allows us to give time to somebody to go and get tested. If they have a negative test, then it doesn't affect the class and they can come back to school or to work. And so we really have 4 to 5 days where we can kind of wait and see what's happening with the individual who has symptoms and what we need to do next. But that sibling would be considered a contact, and so it would follow that same kind of protocol. And I can certainly turn it over to Soda or Heather to include any information on that.
Do you guys have anything else that you want to add there?
No, I think that was a good summary. I also think that there's some evidence and some thinking about why there's this 5-day window, and that's because after exposure, the average time to develop symptoms is right around 5 days, and so you have a little bit of time for students to still be in class, but if they really did have an exposure to somebody who was positive, we'd be able to get them out before they start to spew out germs and infect everybody else.
I'm going to ask you another question, Soda, but before I do, Stephanie, back to that question about do they need to fill in their passive screener on the day that they are sick, or how do they get caught by the system if maybe they've got a case, but they're not quite sure yet?
Yeah, thank you. I appreciate you coming back to that because we really do want to encourage everyone. If you are scheduled for in-person learning, to fill out that daily health screener. Even if you're staying home, it's broken up into major and minor symptoms. And so that gives us a heads up on what we are, when we need to follow up with you and make sure that, you're ready to come back, or if we need to take some next steps. So I would really encourage everyone to continue to do that. Also, if you're calling your child out sick, please, leave those symptoms that are going on attendance. This is really one of those opportunities where it feels very cumbersome, and it can also feel a little bit intrusive at times. But this information really helps us to make sure that we're keeping everybody safe, and in school as long as we possibly can.
Something that's kind of an attachment onto that is the idea of how we do our COVID screening. So again, it's a passive screening. We ask people to do that before they get to school. Sarah Flynn asked, will students be allowed into school buildings without completing the COVID screening survey? Should there be a check outside the building before they get in? I know that it does vary from school to school, especially as we get into these larger high schools. The thought is, that's probably not likely just because of how many students there are, but that there is a check. And then the principal is actually calling or emailing the parent to let them know that they missed out on it, doing an active screening at that point. Do you want to talk about that? Or I don't know if one of our area superintendents wants to join in on that real quick.
I would just say that, like you mentioned, Randy, everybody's doing it a little bit differently. What we are really stressing, again, is that layered approach. And I know we say this over and over again, but we really want parents to, remember to try to do that at home. at the higher grades, for kiddos to stop and think about really how they feel before they go into school that day, and stay home if you're not feeling well. Most of our families are really getting into the habit of doing that screener every day. It takes some time. I can't tell you how many times I've shown up at my office and had to stand there and do the screener before I went in, because it's just something that, you have to get used to doing. That is the first step. If we see somebody at school that is symptomatic or looks like they're not feeling well, then, that next layer is that they go to the health office and they're assessed there, and then they're sent home. And so sometimes folks will get into school without having that done, and we'll work with their families to make sure that it gets done beforehand as often as possible.
Perfect. And I think one of the questions that we had gotten from Christy D from Foothill was, I think reminders guidelines should be published for things that families can do to reduce the likelihood of someone coming into COVID with, coming in with COVID to schools. It's all of us working together and having confidence that everyone will make those choices with the best interest of students' health in mind. I would say that I'll definitely take that to heart. We're definitely sending out messaging to the kids that are going to be starting next week with some of that messaging, but more and more reminders about that for sure. Okay, I promised some questions for public health real quick here. One of the good ones that I thought for you guys would be Andy Gold from Bear Creek Elementary wrote, with kids coming back to school, what are the rules that will be there after Thanksgiving, the Christmas season, that kind of stuff? I don't know that we for sure have any sort of protocols in place yet, but I thought I'd turn to you guys and see, do you guys have any feedback for folks that might be thinking about going through the woods to go visit grandma, or maybe taking an airplane flight somewhere else in our beautiful country or elsewhere?
Sure. Yeah, so we have shared out some guidance around Halloween that we shared from the state. We know that's a pretty popular holiday. So really what it comes down to with every holiday is looking at how much risk you're taking as a family, and thinking about how much risk you're taking and how that will impact your school community, because the choices that we're all making outside of school, including people who don't even have children in school, is going to impact our ability to stay in person. So really the recommendations for Halloween are things like, come up with some other creative ideas in your house, do like a candy hunt or a scavenger hunt or things of that nature, really avoiding any gatherings. There is a discouraging of the door-to-door sort of model of trick-or-treating. People talked about maybe some social distance parades in your neighborhood community, or lining up little goodie bags along the curb that don't involve people coming into close contact. And really, part of the reason we're seeing this increase in hospitalizations has to do with a decrease in social distancing, gatherings, even small family gatherings, from people from different states flying to see grandparents, going to weddings where it feels pretty safe, are leading to some pretty major spread. So as much as we all, myself included, want to get together with those family members from out of state for all of the upcoming holidays, just really sticking with your own communities. My 4-year-old is having a Zoom birthday party with his friends next week. So still continuing to really do that virtual family time and connection as possible, and avoiding just putting everyone at risk.
It really does seem like most of the contacts that we're having, the things that are happening, are coming from outside, social gathering with adults, or, club sports or whatever, versus, we're not seeing a lot of transmission inside the schools. Another question I thought might be good for you, Heather Soda, is from Stephanie Freemuth. She has a kindergartner and a preschooler. She wondered what in metric we'll be looking at to lift the mask requirements. I know that that's a statewide under the governor's orders, but I didn't know if you had any thoughts on that. I guess both of our kids are waiting to enroll in BBSD until we change our mask mandate, which is in alignment with that. So any thoughts about when that would change? It would be when we're up and out of at least protect your neighbor, right? I mean, it's quite a ways up before I think all that kind of gets released. I don't know.
Yeah, Soda, did you want to add anything about that?
No, I don't think we're anywhere close right now.
Okay.
Yeah, I think that is well into the future of this pandemic being under control and moving well beyond where we are currently. So that is definitely not something on the horizon.
Especially yeah.
I also think that even in our ECEs, we're definitely seeing things that are looking suspicious, like younger children may be able to transmit, and that's something that we really have to take into consideration, especially in our families that might have multi-generations living in a household where kids could be exposed and they could bring stuff home to their grandma babysitters and things like that. So we really need to be careful still. While we know it's harder for the younger age groups to be wearing masks, it's something that we're encouraging just because there's risk, and it's coming out in the literature now.
Thank you for that reminder. I think that's good. Just a couple more health ones, and then we're going to get back into the classroom here. So if you're waiting for those questions, please hold on the line here. Katie Davis asked about our elementary students. She found out that they're not necessarily 6 feet distance while they're eating, during the communal, in the cafeteria sort of eating. I know that we're trying to be as socially distanced as we can, but we're also trying to logistically handle the kids that are in there. Is there anything, Sam, do you want to add anything onto that, or anybody else?
Yeah, I mean, I think, again, this is one of those things that's varying from school to school. But in general, what we've seen is that in most of our schools and most of our elementary schools, they're having an empty seat in between kids that are eating, so that there is some spacing that's going on. The one thing that we really are asking people to do within the cafeteria is if there are 2 different cohorts in the cafeteria, that they need to be 25 feet apart. So that we're not mixing cohorts. But yeah, certainly the cafeteria is one of those areas where kids are going to be taking their masks off because they are allowed their masks off to eat or drink. And so there is a little bit more risk there. And our schools, I think, have overall done a really great job of using arrows on the floor and social distancing stickers to make sure that kids are spacing themselves out when they're in line, and really making sure that the traffic patterns within the cafeteria are really controlled so that we're not getting mixture between cohorts.
I think that's a really key thing. The cohort is that envelope that we're kind of keeping that group of kids in. So one of the other rules that we oftentimes will get questions about is when they go outside and they're playing in recess, we are allowing them to take their mask off, encouraging social distancing, but there are times that they get closer together. Again, they're at least in that grouping and not mixing with other kids in the school. So that's part of the thinking in terms of the layered approach. Another one in terms of, sort of how we're approaching things in schools, Debbie Brinkley, mother of a senior, asked, wondering how we're going to handle violations of COVID rules in high school. She's kind of talking about, we don't want it to be a police state, but at the same time, if it's totally lax, nobody protects each other. Margaret, any thoughts on that?
Yeah, Randy, that's a great question. And I think back to when we visited Tech just last week, the students were very interested in being in school. They wanted to be there. There were no issues. I think back to the video that you shared with the board the other day, and just how happy they are to be there, and that very honestly, very much following the rules, understanding the safety protocols and the needs in order to stay in school. These are the things that have to be done. And I do think that our kids will rise to the occasion. I mean, certainly our K-2s have done that, and we saw it at Tech with our high school students, just so excited to return. And I'm very confident that they will keep it together, because they often outperform our expectations. So I would expect the same now.
Thank you, Margaret. Another question that we got, I think might be a good question for Heather Crate or Soda from the health department. We've talked about the indicators that we're looking at. This is from Jenny Newmacher from up in Netherlands at the middle senior high school. She asked, the indicators that were being used to decide if we're in-person, hybrid, or at home. She was asking about the dashboard and the fact that there's at least one indicator that's currently in red. I know that we've talked about this in length at the board meeting, but just to refresh everybody's memory, that those give us reason for concern and something to watch, but don't necessarily immediately snap us to a decision. It's something that we're watching. Plus, I know that we're also looking at the new state gauge and how we're going to be, sort of making sure that that's incorporated in things. Anything that you guys want to talk about in that way?
Yeah, so the school reopening metrics that were released from the Metro Denver Partnership for Health, that I think is the first reference with those three colors of green, yellow, and red, that really was released before we had our state dial, which is another set of metrics for us to look at. And so we're trying to balance all of these different data points in thinking about school decisions. There's not necessarily one single point of data that tips things in one direction or another. The other important thing is that some of the trends are percentages, and then when we look at the actual numbers or dial down into the data, we can see what's driving those percentages. For example, what was happening with our CU affiliated cases. And so they're all metrics that help to inform decisions, but there's not sort of a single metric that is what we're looking at. So it's all data that we're incorporating. And I know there have been discussions among the Metro Denver Partnership for Health, which is the public health directors from our metro region, around anything having to do with school or school closures is going to be a very collaborative decision. It's not going to be, everybody kind of, I think, thinks back to March and when things felt like overnight things moved, but our approach is to look at things on this sort of 2-week rolling timeline and to think about what are the trends, what are we seeing, because they do change. And so we're constantly monitoring, but there isn't sort of, even if one indicator or even two are more in the red, we look at the why a lot of times underneath that.
I think about the CU case, you guys really worked with the city and with CU to really kind of fine tune and look at that specific population and how to specifically adjust that versus like a hammer sort of approach of, okay, everybody stay at home at this point. So we kind of imagine the same thing happening at schools, right?
Right. If we suddenly started to see major outbreaks in all of our school settings or even a school setting, we would work really closely with that school, with that community to put additional mitigation efforts in place to look at driving cases down. And so there wouldn't just be sort of this large sweeping approach. We are in a pandemic unless something more wild happens, but that is definitely the approach is to be more targeted as issues arise.
We talked about the layered approach. Rob Price, I know you're feeling like you weren't going to get a question today, so I want to make sure you're taken care of here. Lisa Weiss, Fairview parent, asked, can we get HEPA air filters in every classroom?
Randy, right now we have installed HEPA filters in our isolation rooms and our health rooms. We are not planning at this time to install them in our classrooms. It seems like a question that comes up frequently is, can we install them in our classrooms? Can we install them in our lunchrooms? And that is not part of our plan right now. We've talked about it a lot, but I'll expand on it. Since last spring, we've done everything we can to optimize ventilation in our schools and increase filtration. So as you're thinking about that in conjunction with all of the other layers that we have in place, and Stephanie and Heather have talked about those, but you think about face coverings, hand hygiene, the passive screening process, cohorting, we believe that has created a really solid layered defense against the transmission within our schools. And I think Heather nailed it a little bit ago, is what we do outside of schools also has an impact on what happens in our school buildings, right? So it's always not an engineering control that's going to solve all of our issues. There are a lot of additional layers that we can put on top of this. We feel really good about the layered approach. So let's continue to implement that with fidelity is where we're at. So, with that said, I do have some reservations with the HEPA filters just based on the size of our rooms, based on the size of our cafeterias, et cetera. So what we are allowing, and I just want to address this, is we've had a lot of PTOs, PTAs, and schools have reached out and they fundraise for these, and we are allowing that. But this is not part of our plan. So the important piece to these is that they're sized appropriately. The University of Colorado has done a lot of good work around these about, they have a spreadsheet out there. You enter in the square footage of the room, the height of the ceilings, and then it'll tell you what size of unit you need for those. But Right now we are very confident with the plan that we have in place and don't believe they're necessary.
Thank you, Robert. Returning back to the idea of quarantines for half a second, we got just got a question from Gina Welk from Boulder High School, a parent there. Said, let's say a teacher sees 25% of their students one day, and by the end of the week, they say 100% of their teachers. If somebody in the Tuesday class tests positive, how would that work in terms of a quarantine? Who all would need to be pulled out for that? Stephanie, do you want to answer that real quick?
None of these are real quick. Sorry. Oh, goodness. There's a number of different things that we would look at. Again, I really hate to say that, but depending on how well the class maintained seating assignments and different things like that, we might be able to only quarantine folks who were in a certain radius of the person who's positive throughout all of those different classes. There's really a number of different things that we look at, but if one person, every group that they are in, within 48 hours of them being symptomatic or testing positive, could potentially be asked to quarantine.
Okay, thank you. And I realize that as I say, very briefly answer that. Speaking of that, I think that is the rest of the health-related questions. So I do want to honor the time of Boulder County Public Health and Stephanie. If you guys need to go off, we're going to dive into some of the school stuff, assuming that some of our folks can stay with us here. And I apologize that we are going into extra innings here, but I want to make sure some of these are really legitimate questions that we want to ask. So we'll go into sort of the days of week. The idea of elementary being 2 days versus high school. Doug Day wrote, why is BVSD specifically unable to get to 4 days a week in-person learning? Also, they want to have middle school or high school with that. They'd really like to know some of the specific metrics around that. Additionally, a 9th grade parent at Broomfield High School asked, why can't a small high school like Broomfield not send their students back at least 2 times a week, especially when other younger kids are able to do that when they're following the mask distancing, et cetera. They even sort of, I thought it was funny, they kind of mentioned that the younger kids lick their fingers. High schoolers won't do that. Carissa Centaurus talked about the $10 million renovation project right here at Centaurus and how it gave huge areas for kids to spread out. Can we get all of our kids back in these spaces? Any of our area superintendents want to take on sort of the issue? We've really been working through the feasibility of this, looking at the health conditions, and I know I just dismissed all of our health people. 1 minute, maybe too shy of this, but one of my understandings is at this point, public health, one of the hard lines is really that we can't go back more than hybrid in our secondary schools. And as we mentioned before, we are treating our elementary students differently than secondary students. But who else can give me a little bit of thoughts, Margaret, about kind of that thinking in the feasibility study that we did?
Sure, and anybody at any point wants to jump in. I think part of it is that our goal is to bring our students back as quickly as possible and as safely as possible. And then when you think about some of our schools, the square footage is not appropriate to bring all of our students back without more space availability. Additionally, we want to make sure that the precautions that you hear our health department talking about, masking, keeping as much distance as possible, not crossing groups. When you're in a typical high school with 1,200 kids, even a smaller high school, and you're passing periods, it's very hard to keep that level of distance in passing. And if we have to quarantine, as an example, if we had to quarantine and we had during a lunch period, kids were all over and there wasn't enough space for distancing and masking, we have to contact trace every single one of those students because they potentially could have passed the infection or have it themselves, have the illness, pass it on to family members. And for us, when we talked about what's that feasibility piece, and we were looking at the time, so remember we've talked about how quickly this information changes, the highest impacted groups were those students that are those people that are 18 to 22. That level of impact is significant when you're talking about high school age students interacting with kids. It's not like our high school kids say, talking to somebody, hey, how old are you first? And we wanted to make sure that we had that level of understanding as we bring them in. Now, obviously our goal is as quickly as possible, similar to what we did in 2+, and accelerating that timeline. As quickly as we can, we will. But if you look at the current dashboard, we have kids that are out, and families that are out while they're quarantining, And we want that impact to be as minimal as possible over time. So as we continue to look at the feasibility, the number of staff that we have available, the student seating charts, the kids passing through periods, moving through the building, in and out of classrooms. I mean, as it is right now, we have closed campuses across the district. I imagine for anybody that's been in any one of those high schools, a cafeteria or an outside area with 2,000 kids or 1,500 kids at one time has a significant impact. As we move through the process, I'm sure we'll be bringing our kids back much more quickly and in a stable way. I think Sam has something to say.
Oh, Margaret, you did an awesome job. I mean, I think you covered it, the scope of all of the issues really well. I think for me, like the big difference between the experience of an elementary student and a secondary student at school that impacts our ability to bring back kids for 4 days versus 2 days versus 1 day is when you think about, if you just sort of think back to your own experience as a student in elementary, you can stay in one classroom with your one teacher for the full day. You have one teacher. You have one group of kids that you're with for the day. When you're in middle school, when you're in high school, you're changing classes all day long. And right now, of course, we only have kids taking 3 or 4 classes at a time, but that's still 3 different groups that you're going to be with. And so it's a really different situation than when we have at elementary. And when we're relying on layering all of these different layers of protection on top of each other, if we can't cohort kids as strictly, then we need to pay more attention to the spacing.
And so, as we talked about before, back in August, we were hoping, and I think that really, I want to underline that we were hoping that all of our kids can come back in phase 4. Essentially allowing for folks that didn't feel comfortable to stay home, but for the remainder of our students to come back. But the public health situation never improved there, and as Boulder County Public Health mentioned tonight, it's definitely not improving right now. So I just want to be kind of firm there, and I think that goes to this question from Jim Peterson, a Monarch parent of an 11th grader. Why are high school students being treated differently and unfavorably? I think we talked about that. Why does VVSD view high school educational progress or mental health less importantly than other students? And I want to say adamantly that that's not the case, that we have to look at the situation, the spacing that we have in our schools, to specific situations in regards to the health of the students, and that's what's making those decisions. And I know our teachers are working super extra hard, and then we're going to talk about that with Kiffany and Heather in just a second here. Before I get to that, Sam, I think somebody was mentioning with the schedule. I think it was Sam in regards to the schedule. We got a question from Kristen Stodden of Broomfield High School, a parent of a sophomore and a senior. Can we go back to a semester versus a quarter structure for second semester? She says that, with the content being crammed in such a short amount of time, it's hard, to cut out. It has to cut out, and students can't be expected to remember all the content they learn for the 12 weeks off between quarters 1 and 3. I think she's talking about AP classes and that kind of thing. I do know that this is, when I've had conversations with you guys before, that this is related and very similar to what we see in some of our colleges. It's the difference between a Colorado college and a CU Boulder, right? Who can tell me a little bit more and what we're looking at moving forward? I think it was important for this structure in order to fit the potential to move forward in the future, right?
I think we're all waiting for somebody else to answer.
Usually you'd have me fill in the rest of the answer, right?
Yeah, no, I think that Randy, you said it really well, that it's the system that we're on right now, it resembles more of that Colorado College model where students are doing something in a lot of depth and for a longer period during the day, but not as much time overall in terms of the number of weeks that they're engaged in that. I think that at this point, it would be difficult to go back to a semesters versus a quarters model. I think that's something that we'll have to continue to look at. I don't think when we talk to our public health folks that there are expectations that the pandemic is going to get significantly better in time for the second semester. So I don't know that we'll really see conditions change. As we've said multiple times, like the conditions that we have to make decisions on are based on our health data. They're based on the space that we have available. They're based on the staff that we have available. I don't think we project that those things are going to change dramatically before the next semester comes along.
And I know we have talked at least briefly about the idea that at least at the high school level, we will reconsider at semester the possibility of 2 days a week and see if that's feasible at that as we lead up to that point as well. I got a couple questions for Robin. Special education, Lena from Meadowlark asked, she's also got a student over at Cole. When do students with IEPs, when will they be included in full-time learning? At least at the elementary level, that's as soon as those kids return, right?
So I'm guessing that the question really is about in-person learning, because students on IEPs are included now in full-time learning, whether that is virtual or in person. And so I do just want to draw attention to that distinction, that all students, whether on an IEP or not, are fully included in 5 days of learning, regardless of whether that is in person or not. And so we currently have our students in our most intensive programs in our special education department for a minimum of 2 days. However, those students who are in K-5 as of in just a few days from now will be in person 4 days a week. However, we do know that there are some students whose families prefer that they remain entirely remote, not in person at all, and we are happy to accommodate their IEP needs and their individual needs as needed.
And I think she, actually, as I read her question, I think, she may have been talking at the middle school level here. She wondered why we weren't prioritizing it compared to some of the other elementary grades. So again, the students that are at a middle school level will attend or have the opportunity to attend hybrid with their classmates, and then they would continue to do the remote learning. Is there anything else to add to that picture?
Correct, and they do then receive their additional services and supports that are identified in their IEPs, either in person or virtually, or in a hybrid too. So even if they attend just 2 days a week, they still receive all of their IEP supports.
Okay. Totally switching gears here. Preschool, well, it's a day of the week question too, but preschool, question of why can't pre-K be grouped with elementary returning 4 days a week? From Kelly, mother of preschool, she says it's silly to have a class with 4 students and 2 teachers twice a week. Why not have 8 students with 2 teachers 4 times a week? I think, obviously there's a number of feasibility questions regarding cleaning, and if I can remember correctly from we've discussed this before.
Sure. Yeah, that question actually sounds like a math story problem. 2 days. So yes, believe it or not, PK actually functions very distinctly from K-5. And that's because, for a couple of reasons. One, because nearly 40% of our families have chosen to have their students remain at home and continue the year in home learning. And because of the very unique and very high standard of credentialing that our early childhood educators have, what they are doing is they are doing the in-person learning and the at-home learning synchronously. And that's because we don't have a fully online option at PK like we do through Boulder Universal for grades K through 12. So therefore, that not being an option, we are working with our amazing pre-K teachers on doing it synchronously. And so kids are with their peers, but they are with their peers whether they're at home or in person at the same time. And so based on that, that's why we are remaining with that 2-day and 2-day model.
Okay, thank you. And I want to thank Tiffany and Heather for their patience, everybody for their patience. This is a very long Let's Talk. But I do want to switch gears and kind of talk about what we're going to see in these classrooms. And I know that you guys have been working closely with teachers, specifically at the elementary level right now that are doing this, hybrid learning and trying to figure that out. It's a brand new arena for our family or for our teachers, for everybody, really, families, teachers, kids. Talk to me about, and we're going to kind of dive into each level and how it looks a little bit, but what first of all, what are you guys seeing as you're working with teachers? Tiffany, you want to kick it off? Sorry, I should have said something. Sorry.
Yeah, so I'll start, and then I'm going to have Heather kind of piggyback on the initial response. But we've had a number of opportunities over the last couple of weeks to talk with teachers in the K through 2 grades about how things are going and what is it like to be in what we're calling a high flex classroom, which is a classroom that has students who are learning in front of them in their classroom and also students who are learning remotely via our camera, our Riva system. And we have just been amazed by the amount of creativity, the way that our teachers are engaging students not only in whole group learning as a whole class, both the in-person and our remote kids, but how they're leveraging different kinds of strategies to do individual instruction and small group instruction to really help our students who are learning remotely feel like they're still part of the class, figuring out ways to build relationships and all sorts of, it's just been truly amazing. We've been nothing short of in awe of our teachers and the work that they're doing in classrooms. So Heather, do you want to give a couple of specific examples of some things that we've seen?
Sure. At the elementary level, especially, the circumstances of each school could be markedly different from place to place, in large part because of just the makeup of the teachers and how many students chose to stay online or remote versus how many came in person. So while the scenarios vary pretty widely from school to school, one of the things that is consistent in every school we've been in, every team we've talked to, is just sort of that commitment to still establishing a community and finding ways for kids to engage in that whole group, like Tiffany mentioned, and also ways to interact while socially distancing with masks, sometimes actually physically together and also on the TV screen at the same time. And to watch the creativity and the heart that's been going on. Of course, it hasn't been without bumps and learning curves, and every teacher and every family needs to give themselves, grace and space to get in the groove. But generally speaking, whether you are all online, all in person, or what is now called the high flex, is a new vocabulary word we're all learning more and more about every day. The commitment to kind of differentiation and collaboration and community has transfers across all of that.
So I'm imagining. Oh, sorry. Go ahead, Tiffany.
Go ahead, Randy. I
was going to say, I'd imagine that what's been learned at K2 probably has a great application at 3 through 5. Do you expect that as those teachers come back and start to work with those students, that these lessons will be sort of plug and play there?
Yeah, that's already happening organically. We met with a team of second grade teachers the other day who had just gotten off of a meet with high school, just to say, hey, here's what we've learned from, plug this in, and because with the Riva system, it's pretty cool. The students who are at home remote learning, you pipe their voices right through in the Google Meet into the classroom, and you'll see kids saying, oh, hi, so and so, and waving, and then what is part of the learning curve for the teacher is learning, okay, so I don't want to hear the kids' voices anymore. Now I need to unplug this microphone and plug in my earbuds. Yeah. And now I can give feedback personally and individually to the students at home. So all of those things, will soon become automatic. But when you're first on that, rounding that bend to learn them, we're just taking it one day at a time.
Yeah, and I think in addition to, and adding to that, and Heather addressed this nicely, it's like a puzzle. At every school, things are different, and within grade levels, sometimes the number of kids who are online might be 4 kids online with 20 in person, or those numbers might be reversed. There's things kind of all over the board there. We also have some situations where the teacher is the person who is remote and being broadcast into a classroom, even specials teachers in the school that are being broadcast into a classroom in the same school. So trying to figure out what that support looks like systemically, we very quickly realized there are some things, and we've got some guidance that we're quickly establishing from what we are learning is working from our teachers, but that it's certainly a highly individualized situation. And as Heather just mentioned, one of the best things that we're learning is that our teachers are learning best from each other right now. So trying to figure out ways that we can help connect them and share the learning across grade levels and our schools has been one of the things that we've really been thinking about and trying to work through over the last few weeks.
I love that, especially the idea that elementary teachers kind of giving a little bit of insight into our high schools. As we think about secondary coming back, obviously it's a little bit different. You can let kids be a little bit more independent. And again, at the high school level, we're thinking about, quarters of kids, for 4 days a week, kind of rotating through there. Any sort of thoughts in regards to, if you were to paint a picture of what that's going to look like, what would you expect?
Sure, I can take a stab at this one, Tiffany, and then I'll pass off to you. So as with anything, every time we come around, the next phase of this reintroduction, we won't be able to snap our fingers and have all of this in place on Tuesday. So we need to be ready to give each other, that grace and space. But what we're working towards in middle schools and high schools, and what we'll be working with teachers with already and continuing to, is that idea that it's essential that every middle schooler and every high schooler still has that synchronous live opportunity Tuesday through Friday to connect with every teacher in every course. Now, that doesn't mean that they'll necessarily be live with the entire class, both the quarter that's in person and the 3 quarters at home. It doesn't mean they'll be live for each of those entire blocks of time. Rather, they might be separated into, for example, let's say everyone's going to stay together to, reflect on something we did yesterday, to work on a couple problems that were tricky, and to maybe kick off this new exciting thing that we're learning, and then maybe transition into some breakout rooms, into some collaborative spaces that are online, and come back together at the end, for example. But what we want to be careful not to get into, and we'll be real clear with this as we're rolling into this next phase, is we don't want that one day that the high schooler comes to school to be the only time they interact with their teacher live. We don't want those 2 days to be the only days that they're interacting with their teacher live, because yes, our middle school and high schoolers are older, but they need that community and that sense of belonging and that feedback just as much as the little guys. And sometimes I have a VVSD middle schooler and high schooler in my house, and I say sometimes even more than the little guys. So that'll be an integral part. And Randy, I apologize, but I actually am getting ready to turn into a pumpkin, so I do need to hop off, and I will. My colleague Tiffany is
No problem. We are innings, and we thank everybody for staying as long as they can.
Take care. Apologies.
Thank
Bye,
you.
Heather.
So
I would add to that too, Randy. One other thing that I think is that we can say with full confidence is all of our teachers know so much right now about using technology in meaningful ways, because they've been living that in home learning, right? So the use of our learning management systems, both Seesaw and Schoology, is really pretty phenomenal. And we see a lot of the classrooms that are running HighFlex right now still using the learning management system as another way to help connect kids. Same thing, using conferences in Schoology or Google Meets to do not just whole group meetings, but also to break students up into small groups so that the kids who are present physically in the classroom can still have small group conversations with their peers that are learning remotely. So the capacity and the creativity of using those learning management systems and our technology tools that we've grown in since last March is really, really benefiting the work that's happening as we return to in-person learning. So it's exciting to see that those things are being leveraged in that way right now too.
And this is exactly why we wanted to have you guys on the call, because I think we've got some questions specifically. I'm almost going to make this fast to answer. I might need the help of the area superintendents in this arena, because again, they might be more firm on actual plans or protocols that we've got in place. But the idea of kind of a picture of what we're hearing from teachers, I think, is key to this whole thing. We may make a future Let's Talk just about kind of viewpoints from teachers, right?
Yeah.
Michael Blenneman from Broomfield asked, are we going to stay in the same current schedule? I believe the answer is yes for that, correct, at the high school level? I'm seeing a nod from Sam, so I'm thinking that that's the case. And again, I think all of us across the board don't feel like it's best practices to have the students in front of a monitor the entire time. So the idea of them learning with their class at a certain point and then going off and doing independent study if they're at home or inside the class, they get one-on-one support from their teacher. It's going to be kind of the key part of that. Again, if a kid's at home, just like they do now, they'll have virtual ways to connect with their teacher, to ask questions, et cetera. One of the questions that came up, Rob, maybe you can answer this. Will kids, this is a high school level, will kids be able to go eat outside or eat inside during their class? Will they be able to do that? Kind of what's the eating situation?
Yes. So right now, all of the above, Randy. We're asking students to stay on campus at the high school level, so we won't have open campuses. We'll still be serving hot food. Food's free through the end of the school year, which is all great, right? USDA announced that, but yes, they'll be able to eat in the cafeteria or other arrangements as made by the principal. It varies depending on which school you're at.
And my understanding is you're welcome to go outside in the grass and eat, outside if they have that opportunity, if the weather's nice and that kind of thing. Another question that came in at high school level, Lisa Weiss, a Fairview ninth grade parent, asked, will high school students remain in a single classroom and with the teachers rotating, or will the students rotate between classrooms? Do you know that, Rob or Sam?
I think Sam or Robin would be best to answer that.
I believe the model is that students will be moving classrooms. I think originally when we were having to keep stricter cohorts, we were not going to do that. But now that health guidance has relaxed a little bit, the idea is that the students will move just like they would during a normal instructional day.
Awesome. I appreciate that. We talked about, I think at the middle school, kind of what the hybrid will look like. Again, just, kind of people wondering what this will look like for them, but I think we kind of got that across. Rachel Walker asked, why is there still no school on Monday? And then she kind of asked about the attendance aspect of things. There was actually an interesting conversation on Facebook that went between parents, and it was interesting. There's definitely some different experiences. I think you've kind of heard loud and clear that there's a little bit of difference between schools. We believe in autonomy, so they certainly have some flexibility in terms of how they do these things. But the expectation, Robin, is that we do have independent learning during those days, and that it's an attendance. It's a day that they're supposed to be technically learning.
Yes, thank you for saying that, Randy, because there is school on Mondays. And you're right, it has been confusing this year because it's not how we are necessarily used to going to school. But it is a learning day. It is just a non-synchronous learning day. So every student has independent learning activities that they are to complete that are given to them by their teacher at the elementary level or their teachers at the secondary level. And that is when the teachers are engaging not only in their planning time, but also in their professional development time. Because to be a teacher in a pandemic, it doesn't matter if you've been teaching 1 year or 31 years. Teachers feel like they are first-year teachers. They have had to completely relearn their craft, and they have had to learn to navigate technology in ways that they never have before and use tools such as the Rivas camera system that you introduced to us at the very beginning that is different for them than anything they've done before. And so that's why we have launch day for them and independent learning day for students.
And so really our expectation is that this is a full learning day. This should not be just throw it away, because this is one of the days that we're being counted on in terms of their learning, CDE,
correct.
Et cetera.
It's 20% of their week. It's 20% of their learning week, yes.
Okay. And of course, as with any of these things, if you have a question or concern, if this doesn't seem in alignment with what you're hearing, please start with your teacher and principal first, and certainly have conversations there. Let's see here. A great question. I think maybe Tiffany might be able to help us kind of envision what this looks like. When kids are coming back in the high school area, do you anticipate that those in-person kids will be divvied up into pods? Will they interact and work together in the classroom, collaborate? We always talk about the 4 C's: creativity,
critical thinking, collaboration. Yeah. Nicely done, Randy. That was impressive.
Yeah, it's been a while. But I mean, collaboration is a key part of that. I mean, and bringing them into school, that's part of the expectation is that they're going to get to see their friends and get to work together, right?
Absolutely. I mean, I think we've done quite a bit of work this fall in trying to gather as many resources and strategies for teachers that can be still used in meaningful ways that might be familiar to them in both socially distanced situations and also in remote learning. So a key resource that we used this fall in professional learning for teachers worked around that idea. So what are some of the things that we use oftentimes for collaboration to get students to work together in effective ways, and how might we still use some of those things in a physically distanced or in a remote learning situation? So yeah, I would imagine not just the kids who are there in person, as Heather was mentioning before, like we're hoping our students who are learning remotely in those high flex classrooms are also able to interact with their peers that are in the classroom through Google Meets or other small group options. So we should be seeing collaboration happening not only person to person in the face-to-face environments, but also with the students who are learning remotely. There's somebody at my door. My dog's very excited about that.
Well, perfect. I think this last question's for Rob, and then we'll tie this whole thing up. I want to just thank everybody for going into the extra innings with us. The last question I thought was interesting. It's just one of those kind of unusual, just, kind of non sequitur sort of questions, but still very, very important to folks, even during the pandemic. Joseph writes from Bear Creek Elementary. He's got a 4th grader. Will students continue to get recycling and composting education from EcoCycle? This is very important to many of us at Bear Creek. The environmental stewardship mentality starts with the kids at school and spreads and grows throughout the world. He said, thank you for thinking about this.
Joseph is a 4th grader. I love how he thinks.
No, I think that's his dad. Sorry.
Oh, okay. Well, I love how he thinks either way. So, no, great question. EcoCycle has been phenomenal through all this, Randy, and we have had to adjust, but they've adapted and they're offering some virtual platforms. So we're not losing that education piece. So all we have to do is schools need to reach out to EcoCycle to get that scheduled. But they've been a phenomenal partner through all of this.
Awesome. Thank you for that. I think the key part of that is just the idea that a lot can continue in our schools, yes, whether that's special guest or whatever, but it might look a little bit differently, right, Tiffany?
Absolutely. I think figuring how all that's going to work is a key thing that our team's working on. We'll have to talk some more, Randy, about the big PBL project we're going to launch in the spring for the district to work with both our teachers and kids in classrooms and our parents and home learners. So lots of opportunities to bring in expertise in ways that maybe we haven't thought of before and leverage different businesses and local organizations. We're excited to kind of see what that will look like in the current environment we find ourselves in. So lots of exciting things happening.
Well, I just want to thank both of you guys. Since you, my 2 favorite people in the world, are last on the call, anything more that you guys want to add in before we close things up?
No, I think the last thing I would say is Heather and I spoke just a little bit about how impressed we are with the work that our teachers are doing, but we just can't say it enough. The amount of, not just the hard work and the hours they are putting in, because they are working hard and very long hours, but the creativity and the passion and just their ability to connect with all of their kids in these very strange situations that we find ourselves in is just incredible. We just couldn't be prouder of our teachers and are so excited to continue to support them and do whatever it is they need us to do moving forward. So just another shout out to our teachers who are just working super, super hard right now. We're really, really proud of them.
Let me say yes, absolutely to that. Thank you. Rob, anything else you want to add?
I'll just expand on what Tiffany just said with our classified staff, and that's from food service to custodial to our bus drivers and bus aides, maintenance to make sure our ventilation systems are working properly. We've talked a lot about, the engineering controls, and I'm really confident in the systems and the work that has been put in place. So no, Randy, thank you for putting this together. I would remind people you've done a great job updating our website. A lot of good information out there. If you have questions, please reference our frequently asked questions. And if you don't get your answer there, reach out to us and we'll get it answered. So Randy, thank you for doing this.
Thanks, Randy. Oh, thank you. I just want to thank everybody for joining us. A couple quick last minute things to think about is, we keep talking about being back together by next week. And the week after that, we will all be back together again. And I just want to remind everybody that it will take all of us to stay together. Remember to wear your mask, socially distance when you're out and about. It's crucially important as part of this whole thing. And thank you. I just want to say thank you for everyone that has, reached out to us with questions on social media, through letters, et cetera. We have a heart for our community. We want to make sure we're answering your questions. For those that were waiting for their question until a half hour after the show was supposed to end, my apologies for that, but I think it shows you that we're really committed to try to get to that place where we're answering everything. I hope you have a great afternoon. We'll see you next time. Thanks.